this. So today I'm going to talk about supervision within integrated care, and more specifically about how supervision, or trying to answer the question, can supervision reduce burnout? Objectives for today's Blitz are to define the different types of supervision, or some different types of supervision, examine some similarities between supportive supervision and restorative supervision models, describe restorative supervision strategies and benefits. So some basic types of supervision that we're all very used to. According to Merriam-Webster, supervision in general is the action, process, or occupation of supervising, which they consider critical watching and directing. So as of activities or a course of action. In healthcare, there are a lot of different types of supervision. These are two of them. So administrative, that cuts across professional roles. Everyone has a boss at some level. Parts of managerial functions are to accept responsibility for the supervisee's adherence to professional and ethical codes and standards of not only the organization that you're in, but the profession as a whole. Educational supervision is directed towards the educational development of the supervisee. The goal is for the supervisee to learn from the supervisor. The supervisor provides feedback or direction for the supervisee to become increasingly competent at their job. When you talk about specifically Ohio counselors, social workers, there's some very specific rules and laws and definitions, but Wallbank and Hatton define clinical supervision as a formal process of professional support central to the role of learning, which promotes self-assessment, analytical, and reflexive skill building. It can also support individual practitioners in their development of knowledge and competence, assuming responsibility for their own practice and enhancing consumer protection and safety in complex situations. Interestingly, Ohio, depending on which specific code you're looking at, for counselors, they define it one way. For social workers, they define it, well, one of them they use work supervision, the other they use clinical supervision, and they're defined nearly identically as that qualitative and quantitative evaluation of the supervisee's performance, professional guidance to the supervisee, approval of the supervisee's intervention plans and implementation, assumption of responsibility for welfare of the clients, and assurance that the supervisee functions within the limits of their license. To throw in an additional wrench, if you look at chemical dependency clinicians in Ohio, clinical supervision is defined as an organized, intentional process that ensures client welfare, supervisee development, adherence to legal and ethical standards. So lots of overlap here, and versus training supervision, which is very specifically if you are a someone new to the profession, you have to undergo training supervision in order to obtain a license, or to obtain the next level of a license, or if you're actually developing a new area of proficiency. So supportive supervision was originally conceptualized to encourage personal adjustment to unavoidable stressors. So building coping strategies through a supportive working alliance where the supervisor is empathic, encouraging, available, and approachable, communicating confidence in the worker, and offering emotional support. This could clearly be found in both formal and informal supervision situations, but it's intended to provide practical and psychological support to carry through the responsibilities of your role. And we can see why this would be important in healthcare, whether that's primary care or mental health. This type of supervision is necessary for all of us because we work with challenging people. Restorative supervision is an expansion of supportive supervision, which was developed as a solution to the emotional demands being placed on the range of healthcare professionals. So the model is designed to focus on the capacity of the individual to deliver complex care in a variety of settings, with a real emphasis on the provider/clinician well-being. It arose from research findings that showed that there had been a lack of focus on the professional's own health and well-being, and their ability to think clearly within their role when their health and well-being was compromised. Restorative supervision contains elements of psychological support, including listening, supporting and challenging the supervisee to improve their capacity to cope, especially in managing difficult and stressful situations. It enhances both those normative functions of supervision and the formative functions of supervision, assisting the supervisee to process some of their emotional reactions to work events. So why offer supportive or restorative supervision? Well, because interestingly, it could help out supervisees and supervisors quite a bit. Supervision in varying forms has been shown to be effective in increasing staff job satisfaction, reducing stress and burnout, and improving the quality of care. Similarly, supervision that either provides social support or assists the supervisee in accessing social support can foster better workplace adjustments. Having a good support network is seen as a key protective factor in reducing stress, burnout, and trauma. Supportive clinical supervision provides peer support, encourages the exchange of ideas and reflections on daily practice, and gives the supervisee space to express concerns about patients and support self-awareness. In a randomized control trial designed to examine the effectiveness of restorative supervision, researchers found that receiving restorative clinical supervision allowed staff to process their workplace experiences, reducing their scores for burnout and compassion fatigue and subjective stress to non-clinical levels, thus allowing the staff member to become more effective in the workplace. The process also showed an improvement in compassion satisfaction scores, which should affect the patient care positively. Beyond just reducing burnout, restorative and supportive supervision may help to reduce turnover. Instrumental support may help employees feel more empowered to make decisions about how they perform their job. Supervisors, through supportive supervision, have been shown to shape an employee's perception of job-related stressors, and supervisees receiving restorative supervision have reported that the process assisted them in improving their own capacity to reflect and cope within the workplace experiences. Through the process of supportive supervision, supervisors are able to also, thankfully, or hopefully, learn about systemic and organizational issues that are going to be important to share with the people above them in order to not only encourage more effective ways of working, but brainstorm potential solutions to larger problems. Seeing as how it could be beneficial in reducing burnout and turnover, I want to review a couple key aspects of restorative supervision, so this can be a tool in our toolbox. Key aspects would be providing a supportive and challenging supervisory environment, creation of a work environment that supports relationship and team building, attempting to help professionals avoid professional isolation, general social isolation, and potentially reducing difficult collegiate behaviors and team issues. Improving the capacity of the individual to remain resilient in the face of challenging work through their ability to recognize personal triggers, encouraging the supervisee to focus on things they can change so that they experience less helplessness, and improving the ability of the supervisee to reflect and think critically, especially in complex and challenging cases, assisting them in exploring assumptions, biases, and the impact of their work on themselves. Some strategies within restorative supervision, clarifying the situation with the employee. So understanding that organizational context. What is it, if there's a challenge that's going on, if the supervisee is struggling, what is it that's experienced as challenging? What are their perceptions of the workplace stressors? Helping them to encouraging emotional processing and personal growth. So a lot of times you have to act as a role model for this, demonstrate your own ability to reflect and your own ability to process through what's going on with work or your reactions to work. Using self-disclosure to address common issues, helping supervisees to make changes in their practice through the reflection. Strengthening the supervisee's personal coping strategies. So facilitating a reflective stance in supervision, identification of personal triggers, negative reactions and emotions, and talking through them. With the caveat that supervision is not therapy. So you have to have a fine line here. You're trying to provide a therapeutic environment without actually breaching into that personal therapy space. And that can be a tough thing, but it's important to do. We know that adaptive coping can enhance a supervisee's sense of self-efficacy and well-being, so we want to help them build those skills. Boosting morale, motivation, and job satisfaction. Being strengths-based, building confidence before addressing problems and deficiencies. Increasing the supervisee's sense of control within supervision. Encourage their engagement, ask there for feedback, and be receptive to it. It's about sometimes being flexible and available. Supervisees need to know that they have access to you, that the door is open, that you'll prioritize them, and that when they give you feedback, you're also going to take that, so there can be a two-way street here. Using social support. What's really critical here is that psychological safety is critical amongst the healthcare team to be effective and between the supervisor and supervisees. Psychological safety is an absolute must if we're going to have effective teamwork and to really engage in effective supervision. And an important note here, supervisors also benefit from social support. So in summary, a restorative approach to supervision that remains solution focused and is useful, it can be useful in reducing stress and burnout. This type of supervision appears to enable professionals to restore their capacity to think about the work while they're about the work that they are undertaking, and therefore can reduce risk within any kind of a higher risk environment where you're working with complex clients and complex patients. Managerial supervision in isolation does not appear to be enough to allow professionals the opportunity to process their anxieties and frustrations about the complex work that they are doing, and should only be one aspect of supervisory experience. And here's some references, and if anybody has any questions.